What I want to talk about today is MRI for spinal injuries. Now, some have heard me talk about MRI before. MRI is not the best test. It's certainly not the best primary test for ligament damage to the spine. MRI generally to a spinal injury is what's called a secondary imaging study. But let me explain, and I've explained this a lot before. MRI is basically today a disc study. Now, there are over 220 specialized ligaments that hold the spine together. They're very, very important ligaments. What the ligaments do is they hold the spine in alignment through all of its movement patterns, through all of its stresses, so that it cannot actually misalign. And you have to remember, the spine is packed in with a lot of different tissue. There's a spinal cord, there's spinal nerves that are coming out, there's spinal blood vessels that are coming out, and there's fat in between to cushion it all. So, but it's very, very tight and very, very compact. So what the spinal ligaments do is they actually hold the spine completely in alignment through all of its movement patterns. There's over 220 specialized ligaments. 23 of those ligaments actually happen to be discs. Now, an MRI is very, very good for a disc study, for determining if you have a disc herniation. That's one of what's a bioimaging marker is defined as something that you see on imaging that indicates an internal body condition. So we have two, when we damage the spine, we have two ligament bioimaging markers. There's two of them. One, you could have a disc herniation, and that is picked up on the bioimaging marker or the imaging of an MRI. The other is excessive motion. So anytime you damage a ligament to joints, you can cause excessive motion. And it's the amount of excessive motion that tells you just how severe that ligament injury or that sprain is. And it tells you exactly what joints are involved. So there's three main findings, right? A fracture, which is best discovered on CT or X-ray. Excessive motion, which is the most severe ligament finding generally, which is picked up on X-ray, and then it has to be accurately measured. So we have things called a CRMA, computerized radiographic mensuration analysis, that is developed and delivered by a team of board-certified medical radiologists with Spinal Kinetics, which is a medical testing company for ligament injuries. So we have accurate excessive motion testing. And of course, anytime that we have an injury with a patient, all of our injury interpretation from the treating doctors should be done by board-certified medical radiologists. The imaging interpretation on injuries is so significant because it drives care plans, it drives reimbursement. They should always be done independent. It also provides the referring doctor with leverage because it's done by an unbiased, independent third party. But the bottom line is that you have excessive motion, which is the most significant ligament finding, and that's what you need to know early on. Plus, X-ray is a primary imaging tool, so it's the most common imaging tool that's used right away. Now, you can also have MRI, but what I wanted to talk about on this program was the fact that MRI has never been designed. It's not deficient. It's just not designed to pick up excessive motion. So let's say that you have a disc herniation. And disc herniations usually repair quite well, depending on the size and the location of the disc herniation. But one of the factors that really complicates a disc herniation is excessive motion. Were the other ligaments sheared? Because if you have a disc herniation that has severe excessive motion at the level of disc herniation, above the level of a disc herniation, or right below the level of disc herniation, in other words, involved with the same motion unit, that ligament condition, which is a combined ligament condition, you have both excessive motion and ligament and a disc herniation, is one of the most serious axial ligament injuries that you can have in the cervical spine. Patients today, the biggest problem that patients have with this particular finding is working with doctors that don't even know it's there. So smart injury doctors know that the most primary test you're going to do for ligament assessment is a good set of stress X-rays. And those X-rays need to be tested by a good, reputable medical company, by board-certified medical radiologists that will actually give the report back to the doctor on the excessive motion patterns that were found on the stress x-rays. Those then are correlated to a motor, sensory, or pain problem that the patient is experiencing. So all imaging studies then have to be accurately correlated with a motor, sensory, or a pain problem by the treating doctor. And that's what smart injury doctors are about. That's what they're able to do very, very easily in the market. They know that's their primary test. They also know, with current research that's out, that if you have excessive motion, especially in the mid-cervical spine or in the low lumbar spine, if you have excessive motion, oftentimes that correlates with a disc herniation. So these doctors also know that they can't determine if they have a disc condition on x-ray. They can determine the severity and location of a ligament injury. They can do that without an MRI. But if they want to know if the disc is involved, then you have to get the MRI involved. So there's two testing procedures. They're both extremely important. There's stress radiology with computerized radiographic mensuration analysis to determine the severity and location of a ligament injury. And then there's MRI to determine if you have a disc complication. And those are the two imaging modalities that are most commonly used in the market today. But what I wanted to explain was the difference between MRI and stress radiology. Because today there's been such an for the last 3 or 4 decades, no, the last 3 decades, 2 decades, there's been such an overutilization of MRI, and MRI has a limited amount of information about the ligament status of a spinal injury. There's far more information to be gained on a good stress radiology set with CRMA than there is with MRI. The data is different. But for a really good smart injury doctor, which is exactly what these patients that have these injuries, whether it's an employer that has a lot of employees that get spinal injuries, these employers need to find smart injury doctors that understand exactly what I'm explaining on this podcast today. You have to understand how important your imaging is, and you have to understand what imaging is used for what. MRI is great for disc, that portion of a ligament injury, but it's not good for the excessive motion. There's 10 ligaments that hold 2 vertebrae together. One of those is a disc. The other 9 ligaments do not get picked up in a general MRI study. That's where your stress radiology comes in. So all I wanted to do on today's program was give you a little bit of information on the difference between MRI. Again, MRI, nobody runs down MRI. However, MRI is somewhat of a limited test, whereas it was never designed to tell you anything about excessive motion, and that is a seriously good test, very cost-effective test for ligament assessment for ligament injuries of the spine. So that's what I wanted to go over today's program. I hope it helps, and doctors, I look forward to seeing you on the next podcast. Thank you.